Welcome back to my channel. I didn't think that I would be coming back to talk about something like this. I kind of expected all my videos on this channel to be about Isaiah and his journey, really, with Down syndrome and his heart defects, and it's going to be a little bit more than that. Some of you guys saw on my Insta story that I posted, oh my gosh, I think a week ago. It's been, this whole week has just been crazy. But I talked about how I got diagnosed with something, and it's something that's been going on for a long time. So I want to talk about it, share how I got to that point, because it's not something that happened overnight, not by any means. So that's what I'm here to do today. You'll have to excuse me. Isaiah's sleeping in that room right there, and I'm in my kitchen. So my microwave, lots of stuff. But yeah, let's get started. So it all started back in 2015. Shortly after Chris and I got married, we were living in Hesperia, and we moved back to Phelan. Shortly after we moved in, I got cold, pretty bad cold, and it wasn't going away. My symptoms kept getting worse and worse, and eventually I got to the point where I was having like tooth pain, like upper tooth pain. And I was like, well, what the heck? So I Googled it, good old Google, and it was like sinus infection. So I go, okay. So I go to the doctors, and they're like, well, I don't really see a big sinus infection. I do see a little bit, so here's some antibiotics, and it should help you get better. So I took the antibiotics, and it did not work. It did relieve some of the pressure on my gums, but I still was very sick, still had a lot of sinus pressure, sinus headaches. So I went back, and they did another round of good old antibiotics, and it did not work. And this basically continued for months. I would go in almost once a month, and I would need more antibiotics, and they'd try steroids. And eventually I developed asthma, pretty severe asthma. I started with a rescue inhaler, and I pretty much use that every single day for breathing. I would wheeze. I would run out of breath walking up my stairs. So they gave me a preventative inhaler, which helped. It pretty much controlled my asthma at that point. I still needed my rescue inhaler a lot at the time. But I was still having sinus issues. I was a lot of pressure in all my sinuses, and a lot of runny, leaky noses, and none of the antibiotics or steroids were working. They tried various different brands, thinking I was having a reaction to them. I even tried humidifiers, essential oils, everything I could have tried, I tried. Everything, it felt like. And eventually, my mom was like, what's going on? You're sick all the time. And I go, I don't know. I'm sick all the time. So she went with me to go to the doctors, and they were like, well, she's fine. I mean, she just has to deal with it. Like, it just is what it is. You know, she's young. She doesn't have any health problems. She's fine. So my mom was like, okay, well, this is not working. So what do we do? And so I had asked, is like surgery an option? Because I had read on Google that deviated septums and different things could cause not my symptoms, but kind of like similar symptoms. So they said, okay, well, we can only refer you to an ENT if we do a scan, and if the scan comes back weird, we'll send you to the ENT. So I go, okay, I do the scan, and then as soon as the results come in, she calls me and she goes, all your sinuses are blocked completely. Like, when she would, because when you think about it, when you go to a doctor's and they look like that little thing, the black thing with the light that has a little thing they put in your ear, they put in your nose, that's only like this big. So like they look in your nose and they can only really see like maybe here. Like you can't see your sinuses that way. So she goes, yeah, you need to see an ENT. And like the ENT was like a 5-minute appointment. He knew right away. He's like, you have nasal polyps. They're very compacted. They need to come out. You're going to get surgery to remove it. And so it took about a year before I finally saw the ENT, and it took a couple months to get to the surgery date, because, you know, they book up. A lot of people have sinus issues or various things they got to work on. So it took a couple months, and I got them removed. And my doctor, my ENT that I see regularly, he loves to remind me that I was the worst patient he's ever worked on because of how compacted my sinuses were with nasal polyps. And it really showed in recovery for me, because it was twice the recovery that was anticipated for most people with nasal polyps because of how compacted they were. What they did in the surgery was not a nose job, like they obviously not a nose job, but they went the nose, like inside the nostrils. They made sure it was as straight as possible, so it's pretty, I mean, most people, it's not straight. It's usually a little lumpy inside your nostrils. So he made them straight, so that way it's easier for me to drain mucus to prevent the buildup. They also cleared out all the sinuses, of course, and all your sinuses are connected. So where they connect, he widened them as much as they would go, because when they would heal, they would kind of shrink down a little bit when they healed. And that was that. A couple weeks after my surgery, I went in and there was some more inflammation, which for those of you who don't know, I didn't know this until all this happened, but when you are sick and you have a cold or you have allergies, that's an irritant and it causes inflammation, and that inflammation produces the mucus. So what I was having was there was no cause for the inflammation. It was just happening. They did do an allergy test via blood work, which came back clear. So there was no need for me to have these symptoms. They were just happening. So they just signed it off as non-allergic sinusitis and mild to persistent, I think that's what it's called. Mild to moderate asthma, basically, because it was treatable with my inhalers. So that was the end of it. I went in regularly and they gave me, I call it a steroid rinse. It's called budesonide. It's a little capsule that you put in a little bottle with some salt water, and then you rinse your sinuses with it, and it kept the inflammation down. So that worked for a little while. Shortly after my surgery in 2016, we got pregnant with Isaiah in 2017, and of course you don't take many medications at all. The only thing I really took while I was pregnant with him was my sinus rinse, because I had to, otherwise I would have issues breathing, and my inhaler for the same reason. And I saw him, I think I saw him once while I was pregnant. I should have scheduled more appointments, but I kept putting it off. I had enough going on with Isaiah's appointments when I was pregnant. So after I gave birth, I finally saw him again, and everything was still clear, so we kept going with the same treatment plan. And again, while I was breastfeeding him, I didn't take anything just because I didn't want to, while you're breastfeeding, you don't really want to take medication just because, your baby's going to get some of what you take usually. So I did have a couple sinus infections while I was breastfeeding, so I had to stop nursing while I took those antibiotics. And then January of this year, I stopped breastfeeding. And of course, everything's fair game again, so I could take, if I had a headache, I could take whatever I needed to take. And we found out, actually, I think it was last year. I almost forgot. So last year, when Isaiah was 3 months old, I got really sick. I had sepsis, which is not related to my sinuses, but they did give me a prescription strength ibuprofen, which I didn't really take at the time just because I didn't feel like I needed it. But then a couple months later, I had a really bad migraine, so I took it, and I had a severe allergic reaction. We didn't know at the time it was allergic reaction. We just thought I had a random asthma attack, but none of my inhalers worked. I had to, what are they called? I can't even think. An ambulance came and they checked my oxygen, and it was really low because I couldn't breathe. So they had to give me breathing treatments in the ambulance, and while I was at the hospital, they had to give me more because I was still not breathing fully on my own and had to get shots. And then a couple weeks later, the same thing happened because I think I took Midol or something that day, and I had a similar reaction. And then the third time, I took a low-dose aspirin because I was kind of catching on at that point, but I wasn't sure. I had a little bit of a headache, so I took the low-dose aspirin, and my entire upper lip swelled, the inside of my mouth, my throat, another asthma attack, had to go back to the emergency room, and that was like the confirming you have a sensitivity to aspirin and ibuprofen. They don't really call it an allergy. I think at the time they just kept saying sensitivity to it. So I had to like avoid it basically. So, which is easy to do. I mean, it's not hard to Google a medication and see if it has aspirin or ibuprofen. And I pretty much just stopped taking anything that was not prescribed to me at that point, just because of fear of those. I mean, when you have an instance where you can't breathe, it's terrifying, you know. So I stopped. Just the fear of that happening, I stopped taking pretty much anything except for what I had already, the sinus rinse, and I think that was it, my inhalers. And then I did get a medication for my migraine, so I wouldn't have to take anything that might contain aspirin, so that helped that. And then that was just kind of it. And I forgot to mention to my ENT, which is my fault, that I developed that sensitivity. It happened right before Isaiah's heart surgery when we found out. So I had many other things going on. I was just kind of put myself on the back burner for obvious reasons. I mean, Isaiah needed more attention. So I didn't see the surgeon again for a while. And then I saw him 3 months ago. And it was actually a really good checkup. Everything was still clear. My sinuses were good. I didn't have any inflammation at the time. I was still on my medication, of course, so that probably was why. And we had talked about me getting off my medication, like getting off my steroid rinse, which was exciting because otherwise, it was either be on this for the rest of your life or we could try to take you off of it. And so I was like, I want to try to get off of it. And so he goes, well, we'll just keep sticking with it, keep doing it, and then in 3 months we'll look again, and then we'll talk about it again. And what do you know, last week I go in and the polyps are back. My sinuses up here are blocked, and they came back really quickly. 3 months is not a long time to grow that quickly. So it was, he told me that they are very aggressive. They're going to keep growing quickly. We need to get them out at some point. He didn't really want to do surgery like right this second. It sounded like he wanted to wait a little bit because I was already having inflammation because, I kind of talked about it in my Insta story, but I had a really dry cough a couple days leading up to the appointment last week. And it wasn't a cold. I had no mucus. It was just like it kind of felt like an asthmatic cough. Like you feel like you need air, so you cough and then you get air. But it's like, it wasn't clearing anything. Like the cough wasn't productive. It wasn't doing anything. It was just a dry cough that I had for a couple days that caused me to lose my voice. And it still isn't quite back all the way, but it's much better. I can talk and people can understand me for the most part. So that was another symptom too. I guess with this thing that I have, you have flare-ups and things can get bad pretty quick if you don't catch it, and luckily we caught it early. So I'm on 20 days of prednisone, which is a steroid that you take. You start off really strong and you kind of taper off of it, and it kind of helps reduce the inflammation alongside with my steroid rinse. But no amount of antibiotics or steroids will get rid of nasal polyps, because the nasal polyps are basically non-cancerous tumors. They are hard, they're solid, they won't fall out, they won't come out, they're attached to your sinuses. They have to go in and they have to cut them out to get them out. You can't take any medication to get rid of them. So what I was diagnosed with was, it's called Samters, I think. I just got diagnosed with it, so if I say something wrong, I am so sorry. But it's called Samters Triad, because you have the three symptoms are needed to be diagnosed with it: the reoccurring nasal polyps, asthma, and a sensitivity to aspirin or ibuprofen. Those three will diagnose you. I also don't have any allergies, because I went to the allergist, they tested me, and I was all clear. So it confirms that it's not a exterior problem, it's a me problem, and it's nothing that I did to cause it. It just is what it is, and I got to deal with it. So they went over my allergist and my ENT were working together, and they went over my options. There's no way to cure it. There's no way to get rid of it. There are treatment methods, but nothing's guaranteed. They were really thorough. They even talked about things that aren't FDA approved, that are in clinical trials, I think is how they worded it, that are options, but they both felt not comfortable with me going through that. They would prefer me to do something else. The most, I guess the one we've all kind of agreed upon that might be better for me is to do something called aspirin desensitization, which is where you go into the hospital for a couple days. You're in the ICU because if you were not, it's very life-threatening, that they give you aspirin, which for most people, like, why would you go to the hospital to take aspirin? But as I've already talked about, I have extreme reactions to aspirin. I'm allergic, sensitive, however you want to word it. If I were to take it at home and not go to the hospital, it would kill me. So it's life-threatening. So we decided I'm going to do this process, and every 3 hours at the hospital they give you aspirin, and if you have a reaction they treat the reaction, and in 3 hours they give you that same dose again until you build a resistance to it, and they build you up to, like, I think it was like 650 milligrams, and you take that every single day indefinitely for the rest of your life. But the success rate is 50 to 80% of improved symptoms and the nasal polyps not coming back as quickly. So it was either reoccurringly get surgeries that take many weeks to heal from, to continually get these nasal polyps taken out, still have these crazy asthmatic symptoms, and also be worried about ingesting anything with aspirin in it or ibuprofen because it could kill me, or try aspirin desensitization and see if it works, because if it doesn't work, I just stop taking it, and it's, you know, I can at least say I tried. And yeah, the only thing is, for sure, you cannot get pregnant while you're taking aspirin. Anyone who's been pregnant can tell you, doctors will say, no, only Tylenol, I don't care how much you hurt. But yeah, so probably not for a while, not going to have any kids, at least not any biological for a little bit. Chris and I have talked about adoption. We know we want more kids, so it's just a matter of when is the right time. Never, but when's going to be the better time for me? When am I going to be in the best? I can't, especially right now, I have nasal polyps. I got things that I got to treat now, because it's just, if I'm ever going to be pregnant again, I need to be in the best health possible before that ever is an option. And it kind of sucks, because of course we want more kids. We want Isaiah to have a sibling, and we wanted them to be close, Isaiah and his sibling to be close in age, but it's just not meant to be. It's just not going to happen. And it's okay, because he will eventually at some point. And if we adopt, shoot, they could be dang near twins. They could be born on the same day. I don't really care. But yeah, so that's kind of where we're at now. We don't know when I'm going to be going through aspirin desensitization, because knowing that I have the nasal polyps, sometimes they don't like to do the, I don't think it's called a procedure, where they don't like to do the aspirin desensitization if you have a lot of polyps, because basically your sinuses are already blocked and they know you're going to have a reaction to the aspirin that causes breathing issues, so they don't want anything to already disrupt it. So I'm on the 20-day steroid, and if it helps, if it shrinks some, or by some miracle they disappear, which won't happen, I already know it because the doctor's already told me it's not going to make them go away, then I can go through with the aspirin desensitization as early as next month. But if after the 20 days they're still there, they've grown, then I have to do the removal and then the desensitization. So that's kind of where we're at. We're kind of in limbo right now, just waiting for the 20 days to be over, and then go from there. It kind of sucks, not gonna lie. I mean, the doctor told me that all of his patients who have this are in their 40s, and I'm 24. I guess I've always talked about how I have an old body because I had back problems and had to go to physical therapy, and there's just always something. There's always something. So yeah, that's where we're at. I am thinking about, when I go to the hospital, I might vlog to talk about it, because I was trying to look up stuff on YouTube and Google, and it was really hard to find people like me who have these issues. There's a lot more involved than just like the 3 symptoms. I mean, I'm losing my sense of taste and smell again, which happened the first time I had surgery. I had it gone for a whole year. It's Yeah, it affects a lot more than just your breathing and other stuff. It kind of affects others, you know. It's hard to enjoy your cup of coffee when you can't smell or taste it, you know. But yeah, that's where we're at. So I will let you guys know if I decide to vlog, or I guess you'll just see it on here. I don't know, but yeah, if you guys have any questions, put them in the comments and I'll either answer it down there or I'll make a whole video if it's interesting. But yeah, I'll see you guys next time. Bye.